Listener discretion is advised.
The opinions expressed on this podcast are those of the individuals, and they do not reflect any official view of the United Steelworkers, USW Local 105, or its officers or sub-board members for officers.
Now, from the banks of the mighty Mississippi, this is Steel Revolution.
Hello, podcast listeners, and welcome to Steel Revolution 85. I'm Roy Hutt.
Sean Geisens.
Brad Grieve.
Man, Sean, you jumped right in there.
We'll save the best for last.
That's right.
Ah.
Thank you, Sean.
Boy.
Most welcome. Thank you.
All right, well, let's jump right in it with some local news. Reminder, we don't have an update yet, but we're owed answers on a grievance we filed on the employment security language. So we're stating that the company needs to offer some voluntary quit packages so we can bring some laid off folks back to fill those spots. Also, around that same time, we did file a grievance on people not having their short-term disability tied to a COVID quarantine before surgery. So as of right now, the short-term disability carrier will not cover that time. If you have an issue with that, reach out to your committeeman or call down here to the hall.
Yeah, and just to be clear on that quit package, is the thought process there, or the language states that people can attain 2 years, and those people, there was, I think, 12 in October that attained the 2 years on the 14th of October. So that should have triggered, with those people still being laid off, that should have triggered the buyout, and then we could have recalled those 12. So that will, every month, people that are attaining the 2 years would trigger another set. So
to go along with that, laid off employees, 8 GMs will be offered a recall. That should have started today. Right, Brad? Did that start? Did they get it started today?
I don't think they got started today. We had some other discussions going on around masks and COVID out there at the plant. So Mike and Jason will get together, I believe, on either tomorrow or Monday to make the calls.
All right.
So we are going to call up to 8 GMs. Potentially, there's only 10 GMs laid off, so potentially we could get through all of them if some people have moved on to other jobs. But anyway, they will go down the list, and when they get 8 that are going to return, that's where we'll be at. So
Other changes due to the lack of work, GMs, because there is work and we've had attrition in the GMs and they're getting thin. But changes due to lack of work, the plate mill will return back to a Monday through Friday 8-hour schedule. And Brad, you got more to say on that one?
Well, I mean, a lot going on in the plate mill, a lot of disruption for the people that work over there. We've had some reductions, of course, with the July 154. There were some people that left the plant in that layoff, and then followed up with 2 different groups that were reduced out of there internally in the plant. So it kind of left some of the crews bare. So the company has been talking to us about consolidating that to a 3-crew system, and the company finally gave us, after discussions, gave us a letter saying that they wanted to consolidate to 3 crews and use a Monday through Friday traditional schedule, which is the contractual schedule that anybody that's been here prior to 2003 understands what that is. But it's just a Monday through Friday 8-hour schedule with weekend overtime, 11 to 7, 7 to 3, 3 to 11, with the 11 to 7 crew starting their Monday on Sunday night at 11 p.m. With that, they gave us some pretty reasonable idea that they'll be there till September, but they will be looking at that in right after the May shutdown or May shift balance, then we will be looking at what it looks like as far as production wise. And there's kind of a number out there of 10 million pounds per month, and that would be kind of a trigger on the company's side that they would then need to go back to a 4-crew schedule. So, but it's not just a 1-month blip. It would be something that they would see that we were coming back, which would be a good thing. Our business would be increasing on the plate side, and hopefully they're seeing something in September of next year. But then again, that long term, it's hard to tell what you have, so we'll wait and see. But for now, 3-crew schedule in the plate mill, and the lockdown will be December 14th. So you'll have between November 23rd and December 13th to get your card in. And the crew assignments will be posted on December 17th.
Brad, because that's a contractual schedule, the company can go back to it. Just to make clear for people out there, the union did not agree to the schedule.
It wasn't an agreement, no. It was a lot of discussion, and they wanted a 3-crew, and yes, that's the contractual. That's what we had here, like I said, prior to 2002, 2003 time frame, when they started the alternate schedules. That was that's our base contractual schedule.
Well, a lot of people wanted that schedule, and hopefully, even if they do get up to where they want to be, maybe they'll reconsider and stay on the schedule.
Well, as I've said, ever since we went off of it, I mean, that's the best schedule for us and our families. And yeah, we'll see. I think we were given a lot of reasons why they went away from that, but I believe if they honestly look at it, they will see that. But right now they're calling it temporary, so we'll see where we end up.
Well, moving on to other things affecting the plant, the COVID-19 virus and it hitting our community hard right now. Said before, hospitalizations are up. Staff is overworked and exhausted. Doug Cooper, CEO of Genesis Health Systems, was in the Quad City Times, and get some quotes from him. Let's just go from the last press conference. So this was Tuesday, but printed the report here on the 11th. So at that time, we have more than doubled from 50 to 105 the number of COVID patients who are hospitalized at Genesis. We are now admitting between 15 and 20 patients every day, and we expect to get much worse. And he said, let me add some perspective. Throughout June, July, and August and September, they averaged 3 COVID admissions a day. So hospitals are entering a bad spot where they're not going to be able to treat everybody. So again, the reason to wear your mask out there and to make sure we're doing the cleaning we need to do and making sure that the company's providing us the hand sanitizer and cleaner is to not stress out the hospital. So if your loved one does need help, they can get all the help that they deserve and need at the hospital, because hopefully the hospitals are not overwhelmed, but they currently are, and there's not much end in sight unless we all do our part.
Yeah, and I don't know the way Roy said that, but I mean, bottom line is it's got the COVID, but we need space for people that, who knows, somebody may have a heart attack, somebody may get in a car accident or whatever. So you may get them through the trauma, but then your trauma room or the emergency room, and then you're going to have a bed for them there at the hospital. So all this stuff piles up. It's not just the COVID cases, it's everything else that we want to have treatment available, and a lot of stress on the doctors and nurses too.
We are still waiting new gators to come in to the hall. They're a little bit thicker of a gator, but we still got our other gators down here at the hall, plus mask. There are still extra masks up at security. I noticed today the old white cloth ones that Brad likes. You said you liked him. Did you say you liked him? It looked like a MASH doctor or something. Didn't you say you liked him?
I liked them on you.
I never wore it.
Oh, well, okay.
Yeah, Sean?
I was just gonna say, when Brad wears it, it looks like a doctor.
Yeah, very sophisticated.
Thanks, Sean.
Like we said, those extra masks are up at Centergate Security. Current number as of now, but fearing that soon we'll get more, is 187 cases at the plant, or people from the plant that have reported a positive. Again, if you are sick, stay home. Do not come to work. Report to medical your conditions, and then follow their instructions on what they need. The documentation you give them result in whether or not payroll sees something that would trigger pay underneath their policy. And then to go along with that policy, a reminder that if you answer questions that you were not following the social distancing or wearing masks within 6 feet of people, the company is not going to pay you. You'll be out. Absences should be covered. The only way you're going to get anything is trying to file for unemployment. Anything else on that, Brad?
Yeah, I mean, there's still a lot of talk. There's a lot of concern at the top levels of the company about how many cases we're having here in our plant. Our community has it. We just talked about that. It's the same, we're seeing the same levels in the community, probably maybe even higher than what we are percentage-wise at the plant. But, there's just a lot of stuff that we can do and keeping our areas clean, and we're putting pressure on the company. We need to look at ventilation in our break areas. We need to look at more break areas. And we need to continue to do the things we were doing when this all started with the hand sanitizer and wiping down PCs and taking care of ourselves and our families. So there's going to be more to come. I'm trying to get the company to work on the safety pyramid, and that means not just putting PPE out there for us to wear, but also looking at these engineering solutions and what can we do more to protect each other, and so we can come in here and do our job. It's I think Illinois is on the verge of doing another shutdown, so if we're essential workers, then treat us like essential workers and get us the things we need. I mean, plate mill, I know they had 19 people out. That's at least 10% of their department. So then that impacts us on an overtime. It doesn't mean anybody's doing anything wrong, but or bad. It's just that it's impacting everything across the plant, and where we are busy in the ingot and automotive, I mean, we're short of people. So hang in there and do what you can do and keep yourself healthy.
No, some instructions are coming out on what would happen if you are sick, if you have symptoms, if you need to quarantine. I know that stuff was coming out. If all else fails, after you contact medical, if you got a 10-day waiting period, 14-day waiting period, put in a call off to Morningstar for your whole time that you should be absent, so that covers your call offs. Then if all else fails, call the Hartford and at least start a claim. If you don't have any symptoms and you're just out on a quarantine, your claim will most likely be denied. But the important thing is if you have symptoms, you get a claim number and you get a claim started and you get approved for that claim. After that, let's say within 90 days of that claim, you end up having symptoms again, or you don't make it into work past screening because you have symptoms, you can do a relapse and then you get a day one pickup, because remember, underneath this new policy, it's a one-time pay. So once you're paid once, you're not going to get paid again. So at least that way, if it's a relapse, you get paid from day one. Any more on that, Brad?
No, I mean, if it's the information came out in the works, and I don't know that it's 100%, but if you have, like Roy said, if you have questions yet, call down here to the hall or call Jason Mucciaroni in HR. He told me he would call people back. We were expecting medical to do more as far as communicating, but they're focused on whether you're going to be quarantined and what information you need. So, like Roy said, we're here. Call us. Either that or just follow the directions we've given you, and you should be good. But if you want to confirm that, give us a call.
All right, and another important tip for people going out and having to deal with COVID, it's very important. If you do not have a personal doctor, please reach out and get a personal doctor. You're going to have problems trying to get paperwork to medical that you need, return to work notes, just going to these convenient care. So sometimes it's very difficult to get them to give you that information, and especially fill out short-term disability paperwork. So please get a personal doctor. Other than that, if you ever have to have FMLA forms filled out or short-term disability for another issue, these convenient cares are not going to fill that out, and you're going to have problems when the need comes for you to fill that out. So again, I urge you, if you do not have a personal doctor, please get one. The United Way campaign has concluded. Committee persons right now are working on distributing the power banks. So those of you that had a rollover donation, the committeemen have your power bank, or should have your power bank, and they'll be handing them out to you. Brad, you want to talk about the Christmas baskets?
Yeah, Christmas baskets. So quite the year we've had. I'm concerned a little bit, but I know our members out there are generous, especially around the Christmas baskets. So the collection boxes are out, and I did put forms out on Thursday. So you can put your donations, and you can put your basket request back into them boxes. I'll be picking them up periodically. You have until November 30th. I think the form says December 1st, but get them in no later than that December 1st date. We are targeting $18,000 again this year. That would be $30 per box, and hopefully we'll be able to do 600 of them. Based on the committee's support, I did send a letter from the union and from the committee to each employee that's laid off. So we have 154 laid off, and we are offering them a food basket. All they need to do is call the union hall so we can put them on our a list of recipients, and then we'll have that list to check them off over at the Learning Center on Friday, December 18th. The big difference this year will be, because of this COVID, is going to be that we won't have a packing event or party or whatever. It's something that I look forward to every year. It's disappointing, but we can't expose that many people in a big group. So the committee, along with some lead team, and we'll see how many people we need. We may need a few individuals here and there, but we will socially distance or physically distance and get things set up, and we will pack those baskets, and then we'll do the normal process on Friday. People will pull up in northwest lot, stay in your vehicle, and we will load the baskets. Bring your letters so we can you can hand us the letters. We'll get you the number of baskets you have, and everything will be good.
All right, another reminder, the Nathaniel Payne Memorial Scholarship forms are due on December 4th. So come down to the hall and drop off your completed forms so your student can be eligible for those scholarships. All right. Grieve, did I miss anything?
No, I mean, holidays are coming. Things are looking dim out there on the COVID front, and it's, even my family. I mean, some of the things we were planning on doing, we're backing off to try and protect each other, and so we won't be getting together, at least at my mom's, and so I know there's a lot of that out there. I think Plate Mill is going to be shut down for the Thanksgiving day, so everybody will be off. Guess it's disappointing we can't do as much to be with our families in larger groups like we normally would, but we will all make the best of it. Everybody should have got a certificate by now for a turkey, ham, or fruit basket, which will be valid starting Monday, and it runs through, I don't know what, it's on the certificate, so if you didn't get one, get a hold of Kelly Jones or HR out at the plant, and they'll figure that out. But everybody should have that in their hand by now.
That it?
Thanks to everybody that voted. Elections there's still some, the House race here in our area. They're going to have to do a recount there. It was within, I think the last I saw, 30-some votes. But thanks to everybody that participated. We had excellent turnout in the country, and it's time to move forward and get some things done.
Absolutely, and happy belated Veterans Day to all of our veterans out there. And with that being said, we've got an interview with Kathy Glosson. She's president of SEIU 199 out of Iowa City. Represents a lot of the workers out at the University of Iowa healthcare and clinics. So decided to have her on to speak of what her membership's going through with this pandemic and what the hospital is going through out there in Iowa City. So we'll be back after the interview. All right, we welcome on the podcast Kathy Glosson, president of SEIU Local 199. Thanks for joining us on the podcast.
Glad to be here.
Well, we usually start out, especially with people coming on for the first time, to try to get to know our guests. So, did you grow up in Iowa, and did you come from a union family?
I did grow up in Iowa. I grew up in Spencer, Iowa, which is in the northwest corner of the state. My parents both were non-college educated workers. Both worked really hard to raise their family. And back in the day when they were able to work and raise a family on the income that they made, life was a lot different than it is now for so many working families. But they worked hard, made a good living, and were able to put my sister and I through college. And back then, I remember growing up in Spencer that some of the best jobs in my hometown were the union jobs at the packing house that used to be up and open in Spencer. So it was a union town with a lot of union workers in it at some point, and that's changed over the course of time. I know the packing plant closed and things have changed there during the farming crisis that we encountered. So I don't come from a union family specifically. My dad was a truck driver, but he wasn't a member of any union at the time. And my mom worked for Sears and Roebuck Company, worked behind the catalog counter. So not from a union family. I didn't know much about unions at all until I got active in the drive for forming a union at the hospital at the University of Iowa Hospitals and Clinics back in the late 90s.
So what did then get you into nursing, and then, like you said, later on, or organizing your workplace?
Yeah, really good question. So, I am a single parent, and I was fairly young when I had my daughter. And I remember going to the hospital in Spencer when I was going into labor to have her. And it was the nurse that was working that night that allayed my fears as a young single parent at the time. And I think that really formulated for me that it was such an important job and had such an impact on my life that I think it did influence my decision to actually go into nursing as a profession for myself. And so, I attended the University of Iowa College of Nursing, graduated, and then went directly to work at the University of Iowa hospitals and clinics. So, it's an amazing profession. It's extremely difficult, and given the circumstances we're in now, it's even more important that we have enough nurses and healthcare workers out on the front lines. But and I think while I was working as a nurse, I noticed that things were changing in the healthcare delivery system back in the late 1990s, and it was causing employers to downsize, merge, forced some of my coworkers to change their they were just automatically changed from full-time employment to part-time employment with no input. Our hours and our pay were being cut, and we had no voice on any of the decisions that were going on. And so we got together and met with a union organizer, and I got the union bug then. I was very active in the organizing campaign to organize my fellow nurses and healthcare professionals, and it was a wonderful day when we won that union. It was one of the biggest union victories in the state of Iowa for public employees. So very proud of my involvement in that, and then continue to be really active in the union as the local union president.
Now, how many workers does your local represent, and then what type of work do they do?
Yeah, so we're pretty diverse, but relatively small local. We represent healthcare workers, nurses, and healthcare professionals in hospitals, in long-term care facilities. We have public school employees. They're not teachers, but they're the support staff in multiple school districts in eastern Iowa. Mostly in eastern Iowa, our membership is located. And we have some Head Start teachers and educators, and we represent about 5,000 employees in the eastern part of the state of Iowa, and very diverse jobs, very diverse group of workers, and it makes it much more interesting to have that sort of infusion of different issues in different workplaces as a union, so you get a real taste of all sorts of work that people do. So I feel really lucky to be able to have that diversity in our local.
I saw on the local's webpage that you guys recently, the membership recently recertified their union there. What have the changes in the public sector bargaining? How has that impacted your membership?
Yeah, it's been difficult, and the law was changed. I think they gutted the ability for workers to have rights on the job when they changed the law here in 2017, and it's been detrimental because of some of the specifics in the law that limit the ability for the union to force an employer to negotiate on issues that we really care about, like a grievance procedure or hours of work, things that are really important to workers at this moment. If the employer doesn't want to agree to negotiate certain items, then we can't force them to, which makes it extremely difficult to win strong contract language for the workers we represent. But here's the beauty of it, and that you mentioned that we just went through this recertification election at the University of Iowa hospitals and clinics, we have over 4,000 healthcare professionals we represent, for the first time did their union recertification vote. And the amazing part is, even though workers are under attack from this law that was passed in 2017, overwhelmingly, in a vote of 2,838 to yes votes to keep their union to 38 no votes to not keep the union, tells me that workers in the state of Iowa, and not just our members, but I know AFSCME and other public sector locals across the state, have a huge number of workers that automatically, every year or two, vote overwhelmingly to keep their union in their workplace, which tells me that law that they passed in 2017, even though it's intended to destroy unions, hasn't achieved that goal, that workers are want a union where they work, and they are continuing to revote, keeping their union during these recertification elections. So the law was tough and hard, but what I'm optimistic about is the number of workers that want to have their union and keep their voice on the job. So I would push back against the next legislative cycle and say you're wasting taxpayer dollars by running these elections, and they're not working to the extent that you wanted to destroy public sector unions in Iowa. It's not working, and let's get back to actually standing up for working people in the state of Iowa and allow for strong collective bargaining agreements again.
Now, would you say out of the employers you're bargaining with, do most of them let you bargain over some of the stuff they don't have to, or do they stick to the line and say, well, we're only here to, I believe it's wages, right? Technically, wages is the only thing you're supposed to be bargaining over. So do most of them let you talk about other stuff and bargain over other stuff, or do they draw a line in the sand and say, nope, this is it, this is the only thing we're talking about?
Yeah, good question there too. Yeah, and it does depend on the employer. We have really good working relationships with many of our school districts, and so they have language, and their contracts are usually renewed and have language, and then that keeps those protections in place for the workers. But we do have some employers who are that the state of Iowa is their employer. Those are the difficult contracts that we have had trouble, and not just SEIU, but a lot of the public sector state contracts that are negotiated. All of us have been only able to achieve wages in our negotiations with the state of Iowa. And so, we're hoping that this recent election that we've had shows the state of Iowa, Board of Regents, and the governor that we don't care that your law is terrible, because we're going to revote our union every single time, and we want a contract, and it sends a message, a mandate to this state that workers want a full and fair contract and not just wages to be negotiated. The other thing is that we're signing up members even though there's wages in their contract, that people believe strongly and still they have protections, legal protections with a union that they wouldn't have if they didn't have a union, and that still matters, even if we can only negotiate wages. So for me, it's really exciting at a really difficult time for workers in Iowa to say we're standing up and we're fighting back to make sure we can keep our union and have a voice on the job, even though you're trying to take that away from us. And I have great hope that if we, in the future elections, that we can change who's leading our state and focus on electing leaders that really stand up for working Iowans.
Yeah, I mean, it's certainly to me, it'd be a period of kind of there's a double whammy for your membership. Not only do they have to go through this recertification, which is unneeded, but you're also dealing with the pandemic, and certainly a lot, if not most, of your membership is in some sort of direct path or helping out with that situation. How many of your members have contracted the virus? And I mean, if you need to break it up, I'm really intrigued to see how many that are working around the University of Iowa hospitals and clinics have contracted the virus.
Yeah, good question. I don't have the data on that because we only know what the public information is, or if our employees actually report it to us. What I do know is, yes, they have been. At university hospitals, we know that they may not be all of our members, but they are employees at UHC, that we get daily reports of the number of employees that have tested positive. And since February, they started tracking these positive cases starting in February. And as of yesterday, from February to yesterday, 937 employees that work at UHC have tested positive at some point during that 9-month period. The concern that we're seeing is that the number of employees testing positive continues to remain steady or slowly increasing, and that's the concern. And one thing that we do know is that the positivity, the cases that are positive of the employees are not being contracted from patients that are in the hospital. There's been no case cited that I'm aware of that anybody that works at the hospital has actually contracted the virus from a patient. And that's a good thing. The problem is they're contracting it in the community. They're going out with their friends, or they're meeting neighbors, or they're going shopping, and they may not be taking those precautions that they need to, and there's community spread. And so that's more of the problem than it is that they're in a hospital setting getting sick from taking care of patients. That's not necessarily the case.
How do union members feel about the way the UICH healthcare systems handling the pandemic, and do they feel safe and protected while they're at work?
Yeah, that's another really interesting question, because we've been talking to a lot of our members since the pandemic really sort of kicked off in March here. And initially, our healthcare professionals and nurses were very nervous, right? There was concern about not having enough personal protective equipment, the PPE that you hear about, the faces, the face mask, face shield, gloves, gowns, the things that they need when they're going into a COVID positive patient's room to treat them. That seemed to improve over time when the hospital seemed to purchase more of the PPE and people felt safe. They shut down non-essential services and surgeries. They strictly limited visitors into the hospital. And so for a while, I think the staff, although it was difficult for them to work in that environment, felt like the hospital was taking the right approach to limiting the spread within the institution. Now that we're sort of we've released and reopened things more broadly, they've reopened the operating rooms, they're doing surgeries, they're doing procedures, they're seeing patients in the ER, everything is back to normal. And so because of that, and then the community spread as well that you're seeing in the state, it's again we're at a point where we're at a critical point, I think, at university hospitals where they're extremely concerned about their ability to take care of incoming cases, whether they're COVID or just a general medical need. And it's not just because of the rising cases, it's because of the number of employees that are missing work because they are in quarantine or have tested positive themselves. So those two things together create the crisis that you're seeing in hospitals across the state, not just at UIHC.
Yeah, besides the PPE you brought up, what sort of protections have they put in place to protect workers there, or what are they, or is there plans to further protect workers than what they've already done? I know I've taken my son up there now a couple times for different things, and see, like, they were temp checking us when we were going in. Everybody that was working there were not only wearing masks, but they were wearing face shields. What else is being done or on that line to protect workers and I guess the patients coming in?
Yeah, I think, there's mask requirement. You just described exactly what still is ongoing at the hospital. So they want to make sure that patients and their families that are seeking treatment there feel safe in receiving their care. I receive my care there, and I believe they are doing a really good job of protecting us and monitoring anybody that comes into the hospital or any of the clinics. And so that's good. What the problem is that what we're seeing now, and you're seeing it in hospitals across the state, is that they're now in such need of staff because of this surge of patients coming in, that they're now sort of loosening their guidelines on when it's safe to come to work. So if now the rule is, and this is pretty much statewide, if you're a healthcare worker and you've been exposed to someone with COVID-19, if you are asymptomatic and you've tested negative, even though you've had an exposure, you can still go back to work with those wearing those protective equipment. And so that's a problem in my mind, is that if you don't have enough staff, you're loosening the restrictions that are there to keep people safe, and it's worrisome to me that we're at that point. But you need a nurse, or you need someone there to take care of you. So what do? We're at this point where, and this speaks to, in my mind, the lack of preparedness and forward thinking by our state. our elected leaders, and even some of our hospital leaders. We've been pushing UIHC for weeks now to be ready for a surge and to let's talk about masks and public changing on how we view wearing masks in public. And we need stricter guidelines around that, or we're never going to contain this until there's a virus or a vaccine that is truly effective, and a lot of us have been vaccinated, and that's not going to happen in the next month or so. So we have a war going on with a virus, and we have leaders that aren't willing to do the steps necessary to actually mitigate the spread of this and protect workers and protect the people of Iowa, which is shameful. As a nurse, I'm shocked, and a lot of us healthcare professionals are shocked at the lack of adequate response by our elected leaders in the state of Iowa on addressing this, and you can hear it from physicians as well.
Yeah, I think what you described as being a lack of being ready. I think that's happening in a lot of workplaces because they're not prepared to have all these people gone, especially with the spikes in cases. To go along with that, kind of a two-part question here, and trying to put it all together. So where do you see our current situation with overall Iowa, if you can kind of speak to that, with the healthcare system? How stressed is it? Is it truly a place where you might get to like in Italy, where you don't have beds, and maybe some of your elderly folks are said, well, you need to go home so we can make room for these younger people that are coming into the hospital? I mean, is Iowa getting to that kind of a level?
Yeah, I think that's a distinct possibility unless the numbers start changing. Just today we have 230 Iowans were admitted just within the last 24 hours. That's the highest number so far. 210 are in the ICUs statewide, and there's 101 patients on ventilators, which is not a good direction to go. And I do believe, and I know hospital administrators have been talking to news outlets about this as well, across the state they are extremely concerned that they are reaching capacity to be able to care for these patients. Not because they don't have the beds. We've got lots of hospital beds, but what we don't have is unlimited intensive care unit beds and staff to take care of those patients, as well as folks that are emergency cases that aren't COVID. And you put that all together, and it is a recipe for disaster, just like we saw in Italy, like we saw in New York City when those hospitals were overrun. I hope that's not where we're going to end up, but unless we change course, that will happen. And we have had the warnings from our health officials for months now, and nothing has been done, and here we are. So the CDC is telling, on the task force, is telling Iowa, you are a red zone, you are in danger, severe danger of losing more lives and overrunning your health system. You need to start doing these proactive steps, which is proactive testing, surveillance tracking, mask wearing. They're very simple. These are very simple. It's just that we've had it so politicized that we're going to let people die because we think it's a political issue. It is not. This is a healthcare crisis, and we need to be united on how we're going to attack it and address it. And until we do that, we are never going to get through this, and the economy is going to tank again because we can't continue to operate like this. So we know how to fix it. We need to jump in and do it. Just get to work. Iowans know how to do that, and we should be doing that now. And our healthcare leaders are ready to lead that, but I think our governor is not, and some of our elected leaders are not, and we have to push them to do the right thing. And I do know Governor Reynolds announced some emergency proclamations that are going to go for 30 days. Even the CDC and all of our epidemiologists across the state are saying that doesn't do it. It's not going to cut it. It's not going to reduce the number of cases at all. So we aren't doing enough, basically, is what I and so many healthcare professionals are saying.
So you'd mentioned, I believe, change the conversation when it comes to wearing masks. And I don't know if you've heard this from any of your membership or people out in public when you're talking to them, but you get people saying, well, the masks are not 100% gonna keep me safe, so there's really no use in wearing them. But for folks that are saying that, and us trying to drive the message or change the message, would that be a sorry, I've got somebody trying to call me, so instead of having it beep instead of having it beep over our conversation, I'll just wait for it to end, because I don't want to press anything, because then I probably will hang up from you too. So it shouldn't take too long here. Okay, we're in the clear now.
Great.
All right, sorry. So when we're talking about masks, I mean, should the conversation be, hey, yeah, the mask you're wearing may not be 100% effective. It's not a N95 mask or anything like that. But the importance of wearing a mask is solely to slow the spread and flatten the curve, therefore putting less stress on our hospitals.
Yeah, that's totally true. And just yesterday, the CDC guidelines now are saying, they used to say that when you wore a mask, you were protecting others, right, from getting it from you. Now they're saying it works both ways. When you wear a mask, you're protecting yourself as well as others. So it works much better than I think they initially even thought. And so that's even more important, that people understand that wearing a mask will save lives. You've probably heard this before, but they're saying that the number of deaths in the United States would have been cut in half if we would have been wearing masks and social distancing and doing those sort of basic things that you do during any epidemic, whether it's an influenza outbreak or the COVID-19 pandemic. So, we have to let go of this notion that wearing a mask is somehow associated with not protecting you, because it is. And we know that it's a fact. And so it's a matter of, tell that to, anybody that doesn't wear a mask, tell that to the family member that's lost a child to COVID-19. I wish people could go into the ICUs. You see it on the news channels. It's horrific. Those visuals of Italy and people laying on the floor in hallways that might be dying because we don't want to wear a mask makes absolutely no sense to me. And so, I would hope that people would understand when a doctor or a nurse or somebody on the front lines of this pandemic is putting their life on the line to save people, the least respect that the general public can do is try to protect us from more of that by wearing a mask and social distancing, not gathering in large groups. We all have to sacrifice for Thanksgiving and Christmas. We've heard that. And so it's on us to take care of us. And we need leaders to reinforce that. And so I just think we weren't prepared, and we haven't done a good enough job to mitigate, and this is going to continue to be a problem unless we do. We have to demand that change, and we have to take responsibility for it. I mean, to me, it's that simple.
Yeah, I think, I had a couple questions in there. What can we do as a general public? What can the state do? And I think during the course of your answers, you've certainly answered that. One thing is there anything that the state and our local officials should be doing with, say, funds coming from the government or whatever to spend on protections and to spend on whatever they need to get us through this pandemic? Is there something that the state and certainly Governor Reynolds should be spending that money on, say, other than she wanted to upgrade the computer systems?
Yeah. You probably don't know this, but a couple weeks ago during our recertification election, we saw that the governor got called out by our state auditor, Rob Sands, on he believes under the CARES Act, the federal dollars that came into Iowa for COVID relief, she spent over $20 million, I think, for upgrading a computer system that was budgeted to get upgraded back in 2019. So they knew it needed to be upgraded, and they're taking CARES Act money to upgrade a computer system for the state of Iowa. Well, we all understand you need accurate computer and data collection, but while hospitals are overrun and staffing is a problem, that money should have been spent directly on mitigating the spread, making sure that hospitals had the things that the preparations, the PPE, and the staff they needed to combat this moment that we're in. And that money should never have been spent on computers. It should have been injected into the hospital systems. Now, I know just last week she announced $25 million of CARES Act money will be targeted for Iowa hospitals for staffing. But it took public exposure for her to make the right decision, and that is not the way we should operate as a government taking care of our people. It should have been a super priority of the governor. Job one is to make sure that people are safe and healthy. And so, yes, the state needs to do more than what we've done, and to help us get through this crisis and try to save as many lives and keep as many staff and workers safe as possible. And that's, again, we need better leadership. And, we have to demand that from her and hold her accountable.
Yep. Circling back around to your membership, how has this pandemic impacted them more than just the risk of catching this virus and putting themselves out there? What is the other drawbacks that have happened that your membership's going through?
Yeah, that is one of the toughest things. I'm taking calls and have been. Even our school district custodians and secretaries were calling early in the pandemic saying, I'm afraid to go to work. It's extremely anxiety-producing if I don't have a plexiglass screen between me and a student that wants to check out a library book. We were very concerned early on about safety. Now you're seeing a large amount of bus drivers and teachers that have been exposed and are out of work, and school districts are shutting down. Our workers in healthcare at university hospitals are extremely exhausted. They are not being given vacation time. They're being denied any time off because of the issues with people being out quarantined. There's so many holes to fill because staff are out that they're not allowing people to take any time off. And so they're working overtime. They're working extra hours. It's a stressful time. They are exhausted. They are exhausted and stressed out. And it's just been really difficult as a leader in the union to say, here's what we can do about it, because we're limited in what we can do about it because we have a shortage of staff, an influx of patients. We need CARES Act money to staff up and make sure people are protected and have get a little bit of downtime so that they can stay healthy and come back to work because we need them. So it's just been really, really difficult, and a lot of folks are angry as well as stressed out. And that's not good. In a pandemic, you need all hands on deck, healthy workers ready to go to work that that are resilient enough to make it through the coming months ahead, because we are not at the peak of this yet. And so I just think we need to do a much better job of protecting people. The university did do, for mental health issues this is causing. We know it's causing a lot of stress and anxiety and mental health issues for workers. They did open up their clinics and physicians for behavioral health issues, so that if workers had concerns or this was causing problems in their lives, that they could be able to talk to someone and not be charged for it. So there were some good things that have come out of that, but day after day, month after month, this wears on people, not just healthcare workers, but just frontline essential workers overall. And we need to make sure that they're taken care of. And that's why the HEROES Act, I think, is on the federal level is so important.
Yep. Great segue into my next question. How would the passage of a HEROES Act impact your membership?
Yeah. Well, I don't know if people know what HEROES Act is. It's the Health and Economic Recovery Omnibus Emergency Solutions Act, which is a lot of words for saying heroes. So, and truly, I know our members are heroes. All of our members, all essential frontline workers are heroes. The problem is we're not treating them like they are. We're not protecting them enough. We saw the the packing plant workers not protected enough. Healthcare workers may not be protected enough or being given the tools that they need to be able to provide care. So the money that would have come from the HEROES Act that passed the House back in the federal House of Representatives in May was a good start. And I know just recently in October they actually upgraded and improved even that initial HEROES Act money. But it would bring billions of dollars into Iowa and states across this country to tackle the pandemic and put more protections for workers in place and support state and local governments that provide essential services like Medicaid to Iowans that may have lost their job during a pandemic, all essential money to go to essential needs of working people and workers in the state of Iowa come through that HEROES Act. And we really need Congress. The House passed it. Now we need the Senate to do the right thing. And it takes pressure from us on our senators to make sure that that gets passed and signed into law. I'm hoping that we'll see some COVID relief package coming out, but I'm not going to hold my breath on that given, where we are with the post-election leadership. So, but we've got a new day coming in January, so we'll have at least I'm looking forward to that day.
Yeah, I think everybody's looking forward to some sort of relief or another stimulus package or something coming out here in the near future.
Yeah. Stimulus doesn't work when you're dead, though, and we need to deal with COVID-19 if we're ever going to fix the economy. That is very clear. And if we have to shut down businesses, and we're seeing that at the hospital right now, they're shutting down in non-emergent operating room and surgeries. So that's going to be a hit to the hospital financially because we didn't deal with the pandemic appropriately. Now we're going to take another economic hit. So I don't know when we're going to learn our lesson because we've already done this before, and now we're doing it again. I would hope that we have learned our lesson and will approach the future being much smarter than we have been over the last 9 months.
Is there anything else you think our listeners need to know?
You need a union where you work because it's unions that fight for the things we just talked about. And workers need protections and rights on the job no matter where you work. And it's clear that workers across this country, if they could have a union without fear and intimidation of forming a union, would want one. And we need to get back to building the middle class and a strong, protective government that actually saves people's lives and protects us as their citizens. And unless we do that, we're going to be in this sort of bad place for a while. If you can't just protect people from a pandemic, why do you have the job, right? So I just think we need to open our eyes and realize how important it is to hold our elected officials accountable. And I hope in 2022, when our governor's race is up and running, that union workers and their families remember this moment and realize that there was not adequate leadership in the state, and we need new leadership that's going to stand up and protect us as Iowans. And so I would just share that with your listeners.
All right. Thank you very much. And Kathy, thank you for taking time out of your busy schedule to talk to us, and we'll pass this on to our listeners.
Wonderful, Roy. Thanks so much for having me on, and stay safe, mask up, social distance, try to have a good holiday ahead, and we can weather this storm if we do it together. So I really appreciate you talking with me.
All right. Thank you, Kathy.
Thanks. Take care.
You too.
Bye-bye.
Bye.
All right, back after the interview.
Pretty good interview.
Thanks, Sean.
You're welcome.
Sean,
Yeah, Roy?
where can people find us?
Gosh, I'm not even ready for this. Man, you threw that at me like a curveball.
Facebook?
Too busy.
You watch yourself over there.
I'm just going to stop.
Apple Podcast?
Listen to this guy over here.
He's skipping around, Sean. It's
Yeah,
going
that's
to bug
throwing
you.
me off. Our Facebook page for the Steel Revolution, Apple Podcast, right? Podcast Addict for Android devices, iHeartRadio app, Spotify app, the Radio.com app, Lipson's website at lipson.com, Local's websites, and the men's restroom here at Local 105 on Devil's Glen Road.
You sound very professional. You must have been in radio.
All right, you want to start that, don't you?
You have extra detail in there.
Well, I'm all about detail.
Very exciting for our next one. Our next podcast will be brought to you by Mike's Recipe Corner.
I can't wait.
Just in time for the holidays. In fact, Sean, I think I can hear Mike in the kitchen right now.
That must be where he's at. Princess is in the kitchen?
Didn't you see his little bib? His little apron?
He's got an apron?
Yeah, it says kiss the cook and F off.
And then he's got a crown that says, like, Kitchen Diva or something on there.
Yeah, where's my spatula?
Kids didn't clean my spatula.
How am I supposed to cook?
What does he cook? I mean,
We're going to find out.
Oh, we're going to find out.
Next episode, next podcast.
We're going to find out. Got a very, very special recipe. He'll be telling us about.
Cooking it up.
Just in time for the holidays.
Hey, Sean, how was the bridge?
Bridge was all right, man. I left early just so I can take some video and some pictures because that's what I do.
That's what you do.
Yeah, it flows really well. It's humongous.
So now we can get from Illinois to Iowa. Can we get back?
Well, that's a different story. You got to take the old bridge for a while. So it's pretty cool. I like it. Yeah.
So has it got like plenty of lanes? So even if somebody crashes and
yeah,
you're gonna have plenty of room to get around.
Yeah, we should take I'm surprised anybody hasn't taken up a bet, like when the first accident's going to happen.
You mean it hasn't yet?
Wow, I haven't got anything on my phone yet, so any notifications.
As long as it's not around the 6 o'clock hour, we'll be all right.
Yeah,
So
and as long as it's not me.
How far behind were they on this span?
I think a year.
A year. So what's the prediction on the other side?
I'm not really sure on that one. I'm sure sometime next year.
Okay.
I don't know.
Yeah, that might be pushing it. Well, I guess not only the 6 o'clock hour. We have other shifts. Gotta think about that. All right. Well, until next time, be safe out there.
And say something good about your union.
Every day, Sean.
All right.
Steel Revolution is a production of Steelworkers 105, Bettendorf, Iowa.